Hello everyone, how you are doing? My name is Olushola Oyelabi, a diabetes specialist. I'm gonna be talking to you today about how to be in charge of your diabetes. As we all know, diabetes is not gonna go away, either type 1, type 2, ladder or MODY. They are not gonna go away. They don't have no cure, but they have what it takes to take care of you if you have diabetes. You're supposed to be in charge, and this is one of the things I always tell my patients: be in charge of your diabetes. Do not allow your diabetes to be in charge of you. Do not allow diabetes to control your life. You're supposed to be in charge. How can you be in charge of your diabetes? You can be in charge of your diabetes by different ways. Taking your medications as prescribed by the doctor is one of the ways by which you can be in charge of your diabetes. If your diabetes has prescribed you pills or tablets, if your diabetes doctors have prescribed you insulin, if you put them on the table for like a month or 2 months, the medication will not go into your body. It won't do anything to you. Your sugar will continue to be high in the blood. So the only thing that you can do to help yourself to better manage your diabetes is by taking those medications that have been prescribed by your doctor. Take your insulin. Take your pills. There are different types of pills, different types of insulin out there that you can take to control your diabetes. There are pills that you can take maybe multiple times a day, like 2-3 times. There are pills you can take one time. There are pills you can take even once in a week. So whichever that your doctors have prescribed for you, take them. Especially if they put you on insulin, you must note that there is a reason or a purpose for them to have put you on insulin. Take it. Don't leave it on the table. Don't leave your insulin in the refrigerator without taking it. Take your medication. So another way by which you can be in charge of your diabetes is by getting up and take a walk. Take a walk, take a walk. Walk around. 20-30 minutes of walk, minimum of 5 days a week is recommended if you have diabetes. That is what we call regular physical activities. You need to move your body. You need to get out of the chair, get out of your comfort zone, move around, exercise, get those muscles move. So you need a good circulation. If you don't walk, if you don't exercise, you may end up having problems. And this problem usually starts from the lower extremities, from your foot upward to your lower legs. And I say, if you have diabetes, you don't want anything to take away your leg or your foot. So how can you prevent you from having bad circulation? Is by getting up and walk around. And this is not only good for people with diabetes or people living with diabetes. If you have high blood pressure, regular physical activities is a must for you. If you have a high cholesterol, regular physical activities should be part of your daily routine. So get up, move around. Another way, which is the third way by which you can be in charge of your diabetes, is by going to your doctors regularly. If your doctor wants to see you back in 3 months, please mark it on your calendar, go and see your doctor. If your doctor says come back in 4 months, go. These doctors are not only asking you to come, they want to see you for a purpose. They want to check your feet, they want to check your body, they want to be sure everything is okay. Sometimes they may even want to see you just to to have a blood work, or even to look at your eyes, or even to just be sure that you are doing okay. So regular doctor's visitation is a good way of you to be in charge of your diabetes. You don't want to have diabetes and never see your doctor for a whole year or 2 years. Some people say, oh, they never even saw doctor for like 5-10 years, and they are proud of it, and they are dying internally because some people don't even know they have diabetes. So if you have it, if you know, please see your doctor regularly. Another way by which you can be in charge of your diabetes is by you maybe brushing your teeth very well. You need to brush your teeth at least minimum of 2 times per day, because having diabetes make you to be prone to a lot of periodontal, peri or gingivitis, any sort of teeth or mouth problems, gums. So you don't want any sugar to eat up into your teeth before it is before the doctor catches it. So you need to be like seeing your doctor, brushing your teeth, doing regular physical activities, and taking your medication. Okay, guys. Another thing is cutting down on the amount of your carbohydrate intake. You should be in charge of this. Nobody is feeding an adult. We only feed babies, right? So if you don't control what you put in your mouth, as in total carbohydrates, if you don't control, you don't watch what you eat, it's gonna be a little bit hard for you to get your diabetes under control. So you must be in charge of your diabetes by knowing how much carbohydrate you're supposed to eat. Don't eat too much carbohydrate. Eat a lot of vegetables. Include protein in your food. At least 3 to 4 servings of vegetables. It's okay. Your protein is very, very important. Meat, beans, cheese, eggs, butter, different type of nuts. So those food fall in groups of protein. Avocados, we call it pear in Nigeria or Africa. Different type of peanuts, almonds, different type of nuts. So if you want to snack, you can snack on those instead of snacking on cookies, instead of snacking on high sugary food. Look for those food that has less carbohydrates, a lot of protein to snack on. So you need to be in charge of your diabetes by knowing the amount of the food you're supposed to eat and when to eat and when not to eat. You can't have diabetes and be eating all the time, and you cannot have diabetes and be drinking malt like you are drinking water, drinking soda like you are drinking water, you are enjoying yourself. Yes, you can drink all of those, but in moderation. I preach moderation to people. Everything we do in essence is not good. So be in charge. Be in charge. Know when to go and see your diabetes educator. That is very, very important. In the US, it is, not mandatory, but at least it is recommended that people see diabetes educator and nutritionist. So the nutritionist will guide you on what you need to be eating and the amount, we call it like a heady plate. So they design what type of food are supposed to be on your plate, on your meal plate. But the diabetes educator teach you a lot of things about how to be independent in managing your diabetes, in getting your diabetes under control. That A1C is a measure of how well your sugar is being controlled. If your A1C is above 6.5 0.7, you are diabetic. Don't be in a denial. If your doctor puts you on medication, like I said earlier on, take it. And if you have been living with diabetes for years, if your A1C is still greater than 7, then your diabetes is not well controlled. So work more to get your A1C to less than 7. And if you live with diabetes, please regularly check with your teacher. I'm sorry, I meant to say regularly check with your doctor. So if you check with your doctor, ask him or her how often are you supposed to be checking your A1C. So if your A1C is still above 7, ask your doctor when and how often do you supposed to have your A1C get checked. For some people, it is recommended for them to do it once every 3 months. For some, they are supposed to do it once every 4 months, and for some, once every 6 months, which is twice a year. So get yourself checked. And your eyes, you need to get it checked too. Have at least your eyes checked by an ophthalmologist at least once every year, minimum of once every year. But it is recommended, for some people to do it twice a year. If you have any questions, please put your comments, under this video. And if you have my phone number, you can reach me. You can, reach out to me with your questions. This is going to be a very short video, and I'm gonna be doing another one very soon. In the other videos, I'm gonna be talking more about other stuff. So this is just the beginning. Like I said, very soon I'm gonna be having like a live chat whereby you guys can be calling in. Then we can be, talking. If you have different type of questions about diabetes that you have not had an answer to, feel free, to ask me, either by sending me a comment or by calling me on my phone number. Once again, thank you for watching my video, and thank you for subscribing and for your likes. I appreciate you. Once again, my name is Olushola, diabetes educator, diabetes specialist. I'm proud of myself. You should be proud of me. Thank you for watching my video. Thank you. Have a wonderful day. Bye.